The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Ciarra Morgan and Samantha Kelly. Ciarra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. Today we have Stephanie Chan with us. She is originally from New York City, and she is a mom of two, super passionate about helping women find answers and trusting their body again, because fertility isn't just about getting pregnant. It's about thriving through the journey. So she is here to talk with us today on our fertility series, and she came to this work after navigating her own struggles with hormone and fertility challenges and realized how many women are being dismissed or giving Band-Aid solutions. So it led her to functional medicine, and she's here to talk to us today a little bit about some of her tips and tricks along the way. Thank you so much for being here with us today.
I'm so excited. Thank you for having me.
Yeah, absolutely. So Sam isn't with us today, but this whole series was her idea. She was so interested in all of the fertility stuff, and she and I both have had kind of our own journeys with that. And we handle a lot of people as birth doulas and come in across a lot of people as childbirth educators as well that have dealt with some sort of fertility struggle. So what are some key signs or markers that people should track in their cycles when they're trying to conceive? Like when this is a job that they have tasked themselves with. Sometimes that's what it feels like.
Definitely. I think one thing that is really helpful if you're not, running to the clinic to get blood work every month is just tracking your temperature. I know it could be a hassle, to do day to day. I know, so many gadgets now, right? Like there's Temp Drop, which is a wearable device around your arm. The Aura Rings has been really popular. Anything that really tracks your temperature from your, like the first half of your cycle, comparing it to the second half, is going to give you a good, information to see if you are ovulating or not. And along those lines, I think just knowing when in your cycle that you're ovulating is really important as well. Just because you're bleeding, on day, the first day of the month, every cycle does not mean that your ovulation is optimal. You could be ovulating too early or too late, and that can also impact your success in getting pregnant.
So you recommend using like the little ovulation strips?
I think that's a piece of the puzzle. I do like the ovulation strips because it gives you like, oh, this is the time to start baby dancing. But for a lot of women who have fertility struggles, with like PCOS or other hormonal issues, that may not be the most clear way to do it. Because for women with PCOS, we might see that peak multiple times along the month, and you don't know when you are ovulating or if you are even ovulating during that cycle. The ovulation test strips actually look for the hormone LH, which is actually a hormone coming from the brain. It's signaling to the ovaries, hey, this is a good time to ovulate, but it won't tell us if the ovaries actually kind of answer to that call,
Yeah.
If that makes sense.
Yeah. And so that in conjunction with the temperature, you think is a good combination?
Yes. And then my favorite and the go-to is tracking cervical mucus. This could be such a taboo topic, or, I think even myself growing up, we're not taught to be aware of the things in our body. We're not,
Yeah.
that it's thought of as like disgusting or kind of like we don't want to talk about it. But that clear cervical mucus that resembles egg white is the most fertile cervical mucus. Anytime in that middle of that, we have a fertile window, because anytime we are producing cervical mucus, that's actually a time that we can actually get pregnant. So that cervical mucus is so important because sperm can actually survive for 72 hours in that cervical mucus.
We could go on for about 1,000 years about how stupid I think it is that we were not taught much about our bodies at all.
Mhm.
And I
Yeah.
have a 15-year-old, and I think I've said this on the podcast before. I can't remember. I think it might have been in the vaginal steaming episodes that we did about how my daughter had, the sex ed class or whatever they call it, lifeguard, I think, when she was in school. And they had them do this, and they were talking about menstrual cycles and all of that. And she came home and she was like, I was like, how was it? And she goes, boring. And I was like, well, come on. And she goes, no, like I already knew everything and everyone else was acting real dumb. She was like, they were sitting there going, oh my God, that's so gross. And she goes, Mom, how can periods be gross? It's literally our body cleaning itself. And I was like, go
Yeah.
girl, you have a
Taught her
doula
well.
mother. It's just because she has a doula as a mom. But
Yeah.
cervical mucus, you're right. It's like thought of to be gross or like always a sign of something bad, which is crazy. That is so not true. And now with all of the gadgets that they have for, you mentioned the Aura ring and all of these other things. It's funny because when I was trying to conceive with her, I was 23 about when I was trying to get pregnant, and I didn't know anything about cervical mucus at that time. I only knew about taking your temperature. I didn't even know about ovulation strips. Like I didn't have all of these really cool gadgets. I was just
Yeah.
trying to remember with an old school thermometer that I think had the
Yep.
two points after the number, what it was. And I was like, I wasn't remembering to do it at the exact same time every day before I got out of bed. And when you're 23, like really, are you waking up at the same time every day? No. So there is so much that goes into it. And it does feel like a job.
Yeah, no, 100%. And that's a really good point that you make, because as good as those new gadgets are, it is tracking your temperature, externally, like on your skin, even the Aura ring, the temp drops and all that. What I like about the basal body thermometers that you are using with like the 2 digits after is that it could give you another layer or a hint if you are struggling with fertility. So modern day women, we are always on the go. Our thyroid is a huge piece of fertility, not only getting pregnant, but staying pregnant. A lot of women, who have some thyroid issues see recurring miscarriages or losses because their thyroid is not optimal. Now, the good thing about the basal body temperature thermometers that you were talking about is that it could give us insight into that. So if you are temping and you are consistently seeing your basal body temperature in like the 96 point something, that could be a sign that you might be hypothyroid, even though your labs look fine, right? We are always told that our labs look great. But if we are consistently seeing 96 point something or like even 95, like low 96, and even after ovulation, we're hitting like 97 point something, that could be a sign that your thyroid is not optimal for fertility.
Wow, dropping truth bombs. This is one of the, before we got on, you guys, she was like, how was it starting a podcast as I'm getting everything set up? And I told you like the, typical things, but then this part is one of my favorite. Like learning new things from people that we
Yeah.
interview is so cool because I had no idea that
Yeah.
was part of it. So that's one sign that something could be a little bit off.
Yes.
If Are there any other signs of someone's cycle being healthy, or if there might be an issue that could affect fertility? Like, is there anything else someone should look out for?
I think the length and the amount that you're bleeding every month is another sign. If you have really light cycles consistently, like where only a panty liner is enough, or, it's kind of medium on the first day and then it's only a 3-day period. Now that anytime we shed our lining, that is coming from, the estrogen buildup from the first half of our cycle and then throughout the cycle. Now, if we don't have a thick enough lining, then that embryo has nothing to implant into. So that's another sign that I see where women are saying, "Oh yeah, I have a 3-day cycle, fairly easy. I'm in a panty liner by day 2 and 3." That's kind of triggering to me that you might not be making enough estrogen to support a healthy egg, to support healthy ovulation and a thick enough lining to have successful implantation.
Well, this is not what this is about, but like now I'm like, I want to know for myself, what is that supposed to look like? What would a healthy one look like?
Yeah, so I don't have like the exact amounts, but we're looking at anywhere between like 4 to 5, 4 to 6 days, even. Some women have 7 days, where you are having consistent, like you're going through like 2 to 3 pads throughout the day, soaking 2 to 3 pads throughout the day during the first couple of days of your cycle, and then slowly tapering off. But that 3 days really light brownish tinge, it's not conducive of a healthy like lining that you should be having every cycle.
Yeah, that's so cool. I mentioned a minute ago, but we did 2 episodes on vaginal steaming. One was for periods, and one was for actually how people can even use it during labor, which was really interesting and enlightening. But
Interesting.
we were talking about that too, like that kind of old blood look that's happening, and like that's not typical. That's not normal. It might be common, but it's not normal. There's a big difference between those two. Okay, that's really cool. So there's a lot of talk that people do about preparing our bodies for pregnancy. But what are the most important, like evidence-based steps that somebody can take before trying to conceive? Is there something that they should be doing?
Unfortunately, I don't think that there's much like solid information out there other than like exercise, eat well, and rest or reduce stress, like stop stressing about it. And I think that's where that's where I fell that's where my passion comes from, because that is all the information women are given. Eat a Mediterranean diet, go exercise. Like, what does that even mean, and what does that look like? And I think that's where a lot of women fall through the cracks, because they're also doing all the right things that they were told to do, going to the doctor, seeing that everything is normal, and then they're still not pregnant. And I think it comes back to that piece where like you're being healthy, but it might not be optimal for conception.
And that's the big reason that we ask that question, right? It's almost a trick question because there isn't a one size fits all approach.
Correct.
And we are given these buzzwords or these, popular things that are going on right now, whatever the trend is at whatever time that is. And it's so variable to each person, it's unique. So, what might work for one person isn't going to work for somebody else because of their thyroid or because of what, any of these other things that we're talking about. And eating well is relative. Like that depends on
What
who
does
you
that
ask.
mean?
What does that mean? What does resting
Yeah.
enough mean? Like some people really do thrive on 6 hours. Hi, not me. Like 8 to 10, please. So it just really is so different for everyone else. Exercise. Does that mean I can go on a walk for an hour a day? Or does that mean I need to be lifting weights? So getting with somebody who can help you make these, determinations about yourself and look at the big picture. And that's what functional medicine, is looking at, is the big picture, not just having this narrow scope to try to make a one size fits all thing.
Yep, correct.
Yeah.
Absolutely agree.
So, are there any common myths or misunderstandings that you hear really often when it comes to cycle tracking or fertility prep that you would like to dispel, or that are little buzzwords for you where you're like, no, wait?
Yeah, I think the one that gets me the most is that you have to try for 12 months before you get help, because there's so much that you could be doing in those 12 months. And I think another piece is like, again, this is personal choice. For a woman who is completely okay with, we'll try naturally for 12 months. And if not, we'll go to the doctor and it's going to be IVF. Like, let's be honest, when doctors tell you try for 12 months first before getting help, after that 12-month mark, you're going in, and the only kind of support that they'll refer you to is going to be a fertility clinic, where they're going to offer either, IUI or ovulation induction or IVF. So, if that is the route that you want to take, that is completely fine. But I know for a lot of women, they want answers. They want to know why their body is not in optimal state for pregnancy, or like maybe they can't afford IVF. So I think that 12-month, try for 12 months, and something is only wrong when you've been trying for 12 months, then come back. It's the thing that keeps me doing this and why I love doing this.
It's so dismissive too, because again, there are a lot of factors here. What if somebody is 40 when they're finally starting to try, and they know that like their window is short on fertility being optimal or whatever? So, maybe they've already whatever, they want a close age gap between their kids and they're having secondary infertility, or like there's just so many unique circumstances that giving this blanket 12-month thing not only feels dismissive, but it just doesn't always apply to everyone. And something could be done so much sooner than that. Like you could optimize. What if 12 months later you're finding out that it was a really easy fix that you could have done 12 months ago? Then you could have not even dealt with the stress of that 12 months. How much added stress did that 12 months bring? And we just said that stress is not good for this situation.
Exactly. And like, I think another thing a lot of women don't realize is that in order for one healthy egg to grow, mature, and get ready for ovulation, it does take the influence of 90 to 100 days. So your egg is not growing just every cycle and you ovulate. That egg that you ovulate this month has already been growing steadily for the past 3 months. So everything you do, every change that you make, I always recommend doing for at least that 3 to 4 month period to really know that it's impacting and changing things, changing the environment, optimizing the egg and the uterine environment.
Wow, I didn't know that either, because we always know like you're born with as many eggs as you're going to have or whatever. Yeah. So we just kind of think about them sitting there chilling, waiting for their turn, rather than that at some point they're like, okay, go. Now it's your time to prepare to go into action. So if somebody was wanting to work with someone like you, when in the process would you say would be a good time for them to reach out to you? Is it before they ever start trying? Is it when they've been having problems for a certain number of months? Are there certain things that they should look out for? And then these are little dings that, oh, this might be a reason to go.
Yeah. So I would say if you look at the statistics, even for healthy couples, it takes about like 3 to 4, some say 6 months for a healthy couple to conceive. And that's just the nature of, are the genetic components right for the eggs? Is everything lining up essentially? Are you timing intercourse at the right time? So I get 2 types of women that come find me. Some women are very proactive and they're like, I want to know, I want to get optimized so that like on my first try, I want to be able to get pregnant. I don't want to guess or have that like, what if I'm having fertility issues? Because you don't know unless you start trying, right? Until you start like not using protection and timing intercourse. And then the other group of women that come to me are the ones who have been trying for at least like 10 to 12 months, and they're not getting the answers and the support that they want from their doctor. They know that, despite their labs being right and they're bleeding every month, something is still off and they want to find answers. So those are like the 2 kind of groups of women that come to me. What I recommend is just whatever fits your timeline, like it depends on like
how type A you are.
Yes, exactly. I
didn't
want
you
to
were
say
saying that first person. No, I will, because I am. That first person you were describing is, hi, that's a Ciarra. That's like, but I want to know for sure that I'm starting off perfectly right away.
Yes, exactly. And the first thing that I look at with all my clients are mineral status. And I know it's so new or just like not known about, but minerals are literally the spark plugs for all reactions in our body. Minerals are involved in helping us have a healthy ovulation, have healthy egg production, healthy cervical mucus. I know earlier we talked about signs to look out for. If you're not noticing any cervical mucus, that's also a red flag, because you need that cervical mucus. That cervical mucus is the thing that allows your husband's sperm to reach the egg in the first place. If you're not making any, or if it's not optimal to help the sperm get there, that's another barrier that you'll face.
Yeah. It's funny that you say minerals because I believe next week's episode, if I'm timing them right in my brain, is with Maya. And she talks so much about minerals. That is like her jam. She's so serious about that. So it's really fun to hear you guys say, congruent things, even though you guys have never met. And all of the people that we interviewed in this fertility series have such a similar outlook and have not communicated with each other about that. So it's really cool to have that. So if someone wanted to work with you specifically, can you tell them how to find you? And I will also add all of this in the show notes.
Yes. My Instagram is dr.stephchanrx. And then you can also email me at stephanie@fertilerootsrx.com.
Awesome. Thank you so much for being here with us. This is really exciting and interesting. And I'm just really excited for the people who listen to be able to have this as a resource for them.
My pleasure. Thank you.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.